All right, I'm going to get us started. So, first off, a huge thank you for everybody for jumping on and joining us. This is going to be a webinar, and the title is Using Social Media to Engage Patients and Families. It's a really hot topic. It's not a new topic, but frankly, it can be done a lot better or differently. That's what our panelists are here to talk about. My name is Dr. Todd Wallin, certified pediatrician for 30 years. I was also a lactation consultant for 25 years. I did clinical vaccine research for 14 years. And if you don't know our story and in the practice that we were all in, our trusted messenger team of four people, which were part of a larger nonprofit called the Public Good Projects, we all came from the same practice where we powerfully used social media. And it made a huge difference in, I think, the care that we delivered. Now, the panelists that we have today are all avid users of social media, and we have a lot of questions for them and asking for tips and opinions on social media. So I'm going to give them some intros, but I'm going to ask them to fill in where they would like to add on to that. I'll start with Dr. Shabbir Hossain, an internal medicine doc down in Texas. I know all these guys from TikTok, though I know some of them are elsewhere, so they're happy to add into that. So Shabbir, anything you want to add to that intro?
Yeah, thanks, Todd. Thanks for putting this together. This is fantastic and such a great topic. So happy all of you could join us. Yeah, I'm an internal medicine doctor for close to 20 years. I love connecting with patients, love educating. I think all of us in healthcare love that. And over the last 10 years, sort of been stepping my feet into social media. 10 years ago, I kind of started on Twitter, or what was Twitter, and saw the immense potential of technology and connecting with other thought leaders and people out in the community. And then Twitter kind of changed a little bit, so took a step back from that. And then hopped on TikTok around the time of COVID and really saw the immense potential and power of connecting with folks, talking about medical topics, fighting back on misinformation, disinformation. It really speaks to the heart of sort of advocacy and public health and how important is the work that we do, educating and talking to patients out, not just in our clinics, but in the world. So it's been a really fantastic experience for 5 years now on TikTok, and really excited to be here with all of you.
Terrific. Thank you very much. I'm going to go to Dr. Tommy Martin next, internal medicine and pediatrics as well, board certified in both, up in the Boston area, I believe. Tommy, I also know you from TikTok, obviously big following there. Tell us a little bit more about yourself.
Yeah, of course, Todd. Again, I just want to echo what Dr. Shapiro had said, and thank you for having us. Such an honor and privilege to get to talk about something that I'm so passionate about. So thank you. As Todd had mentioned, I'm a board certified in internal medicine and pediatrics, and outside of medicine, I do a slew of other things. But social media is something that I've been very passionate about for over a decade now. I started in 2014 and have been active on all social media platforms from YouTube, TikTok, Instagram, Facebook, and it has been extremely powerful not only to grow a wonderful family and build connections and friendships. Like Dr. Vicki and I have been mutual followers for probably 8 years or 9 years. And so to build friendships all around the world has been incredible. But then, as Dr. Shabir was saying, to stop the spread of misinformation and also advocate for very important topics. So for myself, a lot of it is autism awareness, as my son has autism, or rare disease awareness, as my son has Lamb-Shaper syndrome, one of about 500 children in the world. And so it is such an incredible tool to fight so many important battles that I think as physicians, we have to be on these platforms doing this because this is where our patients are at. And we can meet them in the presence of their home just by them holding their cell phone in their hand, which I think is pretty remarkable. So my content is medical education, stopping the spread of misinformation, sharing my life, my journey with fitness endeavors, advocating for my son, and a slew of other things.
Excellent, excellent. And thank you as well for joining. Last but certainly not least, Dr. Vicki Can, ophthalmologist, Southern California. Also, someone who I've been following with on TikTok for a long time. Vicki, can you add to your intro, please?
Hello, everyone. Thanks for joining us. Yes, ophthalmologist, Southern California, but I think most importantly, I am a wife and a mother, brother, sister, family member. And I think, just to echo what the other panelists have talked about, I love being a physician. I love working one-on-one with my patients. But at the end of the day, I think educating the public for the safety and the understanding of the whole population for our future generations, right? Like, especially when we talk about vaccines and things like that, just protecting our most vulnerable. I started on social media mainly like around COVID time, and it was really the thoughts of my children, right? Like, how do I best protect my children and my friends and my family? And that's kind of what spurred things forward there. And again, social media has such a huge impact. We can do so much for so many people. And I love that I can talk about and focus on the things that are important to me and share that with the world.
Thank you. And again, weaving in family, not weaving in family, weaving in medical education. I mean, we all have different approaches. And by the way, I do want to remind everybody this is being recorded, this session, and it'll be out on our YouTube channel for the Trusted Messenger program, definitely by Monday, maybe even a little earlier. So yeah, now here's the deal for all of you guys out there watching, right? The whole thing we've talked about is these are experts in using social media. Today's session and webinar is not about how to become an influencer with like a capital I, like that you need to be reaching New Zealand and get millions of followers. The key here is that we have a lot of healthcare professionals and their practices and sometimes their systems trying to grapple with how to use social media for good. And you've heard all three so far of our panelists talking about how they use it for good: advocacy, medical education, addressing inaccurate information. So, yeah, I think what I'd like to do, you guys have referenced it a little bit, but I'd like to get a sense of your start in social media. So we've heard a little bit of that, but what you found to, I guess, what tricks did you learn along the way that was making it successful for you, that had you do more? Like where were the aha moments for you? And the main thing is we're trying to help people that are either just starting in social media or haven't yet jumped into it. Again, how can they use it to engage their practices, their patients, their community? So if you can weave a little bit of that, your maybe aha moment in your path. Vicki, do you want to start on this one?
Definitely, I can start. I think my aha moments really, I've been on social media for a very long time, right? Like I'm gonna give away my age, like Facebook, right? Like I started there.
You didn't say
Right.
MySpace, so you're still safe, okay?
Right. So I'm not even gonna say. So I've been on social media like forever. But I think things really took off, like I mentioned before, around 2020, COVID time on TikTok. And what I found and what my aha moment really was is people have a lot of questions. Like they have a lot of questions. And what I found that really made my content go viral or, got a lot of responses is when I was just answering the questions that people had, you know? And so I think a good starting place, and I've had this conversation a lot with friends in practicing, how do I start? FAQs, starting your FAQs, right? Frequently asked questions. What conversations are you having every single day in your office with patients? I would just start there, right? And then it actually then just becomes, I don't want to say easier, not easier, but people always ask, well, I can't think of content. It'll come, because what happens is once you start, hitting your FAQs, stuff pops up in the comment section.
Yes.
All the time. Yes. And it's just, and you can't keep up anymore. It's just like, and I think that's a great place to start.
To your point. Yeah, to your point. So Chad Herman, who's our VP of Communications Strategy here in our pediatric practice, said, you guys already have content. You say certain things like thousands of times per year, don't you? And they're like, oh my God, all the time, like safe sleep. Let me talk about that. Or sun protection. Or he said, like, just the things that you say repetitively in the exam room is great content. And then to your point, Vicki, then following the questions that come off of your posts are going to give you huge guidance. Tommy, aha moment. When did you know it was working for you? How does somebody know if it is working to kind of push further down the path on social media use?
Yeah, for sure. I think I probably have a little different perspective than a lot of people, but when I first started social media, my goal was that if it helped one person, I would never stop making content. And so my aha moment was the first time I received a comment or a message from someone saying that my content made a difference in their life. And that's all I needed to make content for the rest of my life, because I know that all the work, everything that I'm putting into it was worth it if it helped just that one person. And so with that promise I made to myself in 2013, I've never stopped making content. Now, that's not to say that I had rapid growth. I worked extremely hard on social media from 2013 to 2019 and had very, very, very little growth. But it was never about the growth. It was about helping one person. And so that was my motivation every single day. And to this day continues to be my motivation. Now, do not get me wrong, the followers and all of those things are nice, but I really hope, and I believe I could say this because I did it for 7 years before having growth. I really hope that I'd still be making content today, even if I would not have had that growth. And so the growth came in 2019 when I saw a video by Gary Vaynerchuk that said, if you're not on TikTok, you're missing the boat. And I was like, what's he talking about? So I downloaded the app. There were really not any doctors on there. There was one who doesn't even make content anymore. And I was like, well, let me figure out what content's doing well, not doing well. So I studied the app for 2 weeks. I saw what videos did well, which ones did not do well. And I made my first video and I had 50,000 followers overnight. And that video had like 750,000 views, which was absolutely mind blowing. And so over the time, the ability to grow on social media has allowed me to help millions more people. And so my aha moment would be comments and messages I get from people telling me that I've made a difference in their life. And I actually have a folder in my phone that says my why, and it's screenshots from either patients or from followers online that had told me ways that I've made a difference in their life. And when I feel like social media is too much work or it's too hard, then I go back and read that folder and be like, this is why I did it. Like, this is why all the hours of doing this is worth it. This is why all the negative comments I get from anti-vaxxers are worth it, right? Like, and so I'd say that was my aha moment. Now, in terms of content creation, I'll just give very short advice, and that is be authentic, be as transparent as you're comfortable being, and make content that you're passionate about. So if you do not know where to start, I would say create 3 pillars. And those 3 pillars are the 3 things in your life that when you think about them, your whole body lights up. Whereas like if you were to talk to them and walk into a room, everybody in the room wants to hear from you because you're so jacked to talk about whatever topic that is. And whatever those 3 pillars are, write 3 things under it that you're going to make a piece of content on. That's 9 pieces of content. Do it over 2 weeks and then just go from there.
It's, again, awesome advice from you both. I love the drawing the power from the vision of protecting your family or driving the passion from things that you innately have just right at your disposal that you're incredibly comfortable and passionate about. Shabbir, your aha moment and how you knew it was working and what kind of process you use going forward?
Yeah, absolutely. I think, for us that take care of patients, we see patients one-on-one and we hear their struggles, we hear their frustrations, and, we talk about how broken our healthcare system is. There's so many dysfunctional elements to it, and we hear about it every day in our clinics. And so, when you hear those stories and there's this part of you that's like, wow, what can I do to make a difference? Obviously, I'm making a difference in this patient's life in front of me, but you want to make a bigger impact, right? You want to advocate for important things because there's so many things that need to be fixed in healthcare. And then you just kind of realize, you look at data, there's 7, 8 billion people on this planet, and most of them are on social media. And so everyone's connected. We are all connected to almost everybody else on this planet, right? And so I look at the numbers and I was like, wow, we're connected to the entire planet. We really have an ability to make change with whatever we're passionate about, as Tommy was saying. So whatever you're passionate about, there's people out there that are actively craving for answers, for solutions, for inspiration, you name it. And we're connected. We just have to find that connection. Now we have the technology to connect us. And so I realized we're connected to the whole planet. Everybody's on social media, and there's people that are craving for advice, craving for good information, craving for trust. I was like, this is it, man. This is the way I'm going to make a bigger impact more than I am day to day with my patients, which is obviously extremely meaningful. But you want to do something bigger. And I think this is a great way to sort of reach other people beyond your clinics. And so that kind of really just made me think, you know what, I've got the time, I've got the energy, I've got the inspiration and the motivation. Let's go do some good, right? And so that's kind of what got me onto, TikTok, especially in the context of what was happening with COVID and all the misinformation, people not taking it seriously. There was this existential crisis of, gosh, this impending doom coming. And we've got this knowledge and motivation and power to make an influence. So that was that aha moment. In terms of tips, I mean, honestly, like I said, there's billions of people on social media. There is somebody interested in what you have to say, whether it's a very niche topic or something very broad. There's people that are waiting for your information. So don't hesitate. Whatever niche topic you're interested in, someone will find you. The algorithm works in mysterious ways that people that are interested in your topic, they will find their way towards you. They will end up in your comment section, and you're going to get that positive feedback. Thank you for this information. Thank you for making a difference in my life. And it's just such a good feeling to know that you're positively influencing someone, getting them good information. So don't worry if it's a niche topic. Don't worry if you don't have a ton of followers. I kind of represent the small to mid-size following, sort of creator here. And I enjoy it. I don't have a huge following, but the one that I have, they really appreciate what I bring out there, and it's just fun interacting with them. They will find you, and so the key thing is just be comfortable putting yourself out there. Don't worry about the numbers. Like Tommy said, find something you're passionate about and just go with it.
Yeah, thank you, Shabbir. I will say the trusted messenger program, right? So we had this experience of using social media in a very robust way in our practice. Coming over into the trusted messenger program, our full really mission is around changing the way healthcare communicates and empowering healthcare providers with good communication, both face-to-face, in person, and using other tools. This webinar is focused on social media. And so I do want to get back to the point of, all of you are reaching people outside of your practices. Got it. My question is, how about people that are in your practice? Do you see that it impacts your practice, the questions they ask, the way that you can communicate, how engaged, how informed they are? I would love to hear an example, Vicki, of how does social media impact the patients you actually serve in person as well?
So my patient population is much older. I'm a glaucoma specialist, ophthalmology. So
Are they lip
I
syncing and are
want
they
to
doing some of the dance
say
moves
that I
or?
have yet to, maybe once or twice, where a patient knows me on social media, is in my chair. And I don't mind that at all. Like I love the anonymity. So I don't think I can answer this question as well, though I have lots of friends. And I think one really, really cool way that one of my friends, she's a family practitioner, PCP, her passion is nutrition. So she will create social media content on nutrition. Like she'll be cooking or recipes, and she will share those with her patients. And I love that.
Very cool.
Right? Because you can only spend so much time talking about diet's huge, obviously. I mean, huge. And you can only spend so much time. So what she does is she refers her patients to her social media platform where she shares all this amazing information about food and cooking, and that's how she utilizes it. And I love that. I think that's amazing.
Yeah, Well, again, like you said, it's a person, like this shouldn't be work, right? You want to tap into all the things that already just drive you forward on your day-to-day passion. Um, I will say, Tommy, your health and fitness and nutrition path has been really cool because you shared your personal story there, and both you and your wife's paths and what I would call really extreme sports. Because if I run more than a half a block, I'm hurt. I can swim, but I can't run. So talk about how you've weaved your fitness and health and even weight. Weight has been a big issue because I see you call out other videos on weight and weight shaming. We all, I've seen Vicki call out people who are doing the shaming stuff too. It's just, can you give us your thought on how you weave in that personal piece of your life?
Yeah, I would love to. And I'm going to touch on the previous question just briefly. And
Yeah.
so for me, I'm a hospitalist doctor, so I do not have my own clinic, but I've had many instances where a patient who they're extremely sick, and so their parents are bringing their really, really sick child in, and they see that I'm their doctor, and they'll say, "Oh my gosh, thank you. It makes me feel so good knowing that you're the one that's going to be providing care for my child because I know you from social media, and I know that the care that you're going to provide is the same care that you would provide for your own kids." And so like that would be one example, just building that trust. And with that trust also comes, I've received countless messages or encounters with patients who told me that they chose to vaccinate their children despite what the government or politics want to say about it because they trust me from knowing me from social media. And so I think it has that great power to build such great trust. But I think part of that trust comes with how transparent and authentic are you going to be with your audience online. And so that weaves right into the next question is that I would say that I'm very vulnerable on social media. And there's no right or wrong answer to how transparent and vulnerable you want to be. This is different for every single person. I am probably at one extreme end, whereas other people may be more in the middle, but I share everything. So I shared my struggles of growing up in poverty in a family that was broken by drugs and addiction, and a family that struggled with obesity, and our whole journey through that. And I, just to kind of show you the power of that, I recently did a carousel post 3 days ago that I think has 4.5 million views. And it was about growing up on food stamps
Yeah.
and offering to help other families in need. And my community raised $6,000 in 24 hours to donate to families that were in need. And so I think by weaving in my own personal life and struggles that I faced and victories that we've had, it allows my community to feel like we are one big family, and that if there's something that I believe in, that they want to support that. And so, as Todd mentioned, I do a lot of sporting events. And so I recently did the hardest mountain bike race in the world, which was incredible. And in doing so, we raised $122,000 to buy bikes for children in South Africa. And so that was only able, well, we were only able to do that because I share all of our journeys about like sporting endeavors and things of that nature that we're doing. And so I think it allows people to see that you're not just some robot sitting in a hospital or a clinic, that you're a real human. You have feelings, you have downfalls, you have hardships, you have successes, and it allows them to be part of all of it.
That well said. Again, nobody should ride bikes like this guy. I'm just telling you right now, you should have like bubble wrap everywhere. It's probably not safe for most people, but I think it's amazing. The fact that you both have brought up the way that you could weave in your own personal life as much as you feel comfortable doing, I think really goes to the point right now that you hear so much about the erosion of trust, and how many other people are competing for patients' eyes and ears. And oftentimes they're way better communicators than us. Not because we're not good at communicating, but we haven't been taught, or not that we're not capable, but we haven't been trained. I mean, I ask physicians, nurse practitioners, physician assistants, midwife, like none of us got communication training, let alone social media training. So social media does provide scale in a way that you can only see 20 or 30 patients in a day, depending on, maybe a few more. You can't see hundreds or thousands. And that's a real power to this medium. And again, at the Trusted Messenger program, we're now talking to health systems and super practices and all these groups that are trying to wrap their head around it. And I explain, like, you have resources. This is a powerful education tool, a powerful way to drive quality outcomes in a way that you couldn't otherwise reach people. Now, Shabbir, something that I love, a series that you do, you don't even speak a word. You put up a soundtrack and you say 5 things my patients have taught me, which I love because it really gives you that, like, you're sharing what people are teaching you, which is then right back out to the public to see. Like, where did you get well, one, I want you to also answer, does it impact the patients you serve? But I love that segment, and can you tell us a little bit more? Because I see that as a recurring content piece that you do.
Yeah, absolutely. I think the stuff we deal with day to day, whether it's in the hospital and clinic, it's applicable to everybody. And so, like I said, I know the stuff that I see every day, there's tens of thousands of people dealing with the exact same issue. They just want to either get their symptoms validated or they just want some guidance. And so I think our lives are so rich of information and experiences. There's so many people that, can benefit from it. So to me, that's an easy thing. I just look at my schedule. I've got 20 patients. I just pick 5 things, and there's usually 5 interesting things, more than 5 usually. You just put it on there, put on some good music, and the algorithm takes care of the rest. And so those videos get a little bit more legs for me. Just I think it just appeals to people. It's got some music. It's simple. It's 30 seconds, and it's I think it works well for me. And so I just enjoy doing that. And I was just encouraged, like I said, whatever you do every day, there's valuable information, there's valuable sort of guidance, there's valuable inspiration there. So just want to encourage everybody to keep sharing. It doesn't take much. I just pull it from my schedule and that's it.
Yeah, I do think it's very, very, very powerful. And it quickly jumps out because I like those lessons that you can pull from your own clinical day. Vicki, and we can take some questions if people want to throw them in the chat. One that I think is probably circulating right now is, what type of insurance do you have on your phone, or do you have some kind of case that keeps it from breaking? Because you keep pounding it at the end, but I know that's your shtick, like that is your thing. I don't know how that came about. And for people that don't recognize, there are people that out there that have their thing. Like, Tommy's throwing out sports things, and, Zach Rubin's throwing his hula hoop and his bow ties. Vicky is whacking the heck out of her phone though. Like, just listen to me right now. I can't, I don't want to hit my computer. So I don't, do you have special insurance on your phone or some serious like earthquake case, proof case on it? No.
No.
Okay.
It appears harder than I'm actually doing it. Okay, so don't worry. My phone is okay. All right. The only cracks are from when I drop it.
That's
But
fair.
but you bring up a really great point because this slapping the phone thing, 6 months? Like I don't know how long I've been doing it.
It's,
And it literally by chance, right? And a point I want to bring up is, people are always so worried, like, oh, what do I do? How do I do it? Things, you know, it evolves, right? What I was doing, 1, 2, 5 years ago is not necessarily what I'm doing now.
yeah.
You're gonna have to see what works and what doesn't. Tommy kind of touched on that, right? You see what works, you study the algorithm, you kind of figure things out, not every video is going to go viral, right? Like there's trial and error. And it's so funny because I think I did that once and people liked it. And then I must have posted another video and they're like, where's the phone slap? And I was like, oh, I guess they want it now. And
It's
that's
your
just, it just,
thing.
yeah. And it just, so I started doing it. And then I'll always get like a complaint, like, oh, I hate the phone slap. So I'll like not do it. And then they'll keep on asking for it. You know what? So now I'm going to embrace it for as long as it lasts, but yeah, that's funny that you bring that up.
Well, no, I will say, right, like for the people out there watching and just thinking about it, right? Some things you just pick up on and see what resonates, and sometimes you like almost workshop it over a few different videos or a few weeks to see if is it resonating or not. And yeah, I didn't give you guys my backstory, who the people that are watching there, but it was my daughter who was going into public health January 1st, 2020, and said you should go on to TikTok. And I don't know. And it was like January 1st, right? Pre-pandemic by a couple months. And before you know it, I'm like I had a wardrobe. Like I was dressing up for parts of Hamilton and I was doing like Willy Wonka. And, my wife cringes, but, there's certain prices we're going to have to pay. And my wife recognizes that that is a price. But yeah, and for me, it was kind of cathartic. It's just fun to get out and do things. I do want all three of you made mention of taking on inaccurate information. And I will tell you why I keep saying inaccurate information, because there is now communication data around by saying mis or disinformation that seems to, alienate part of the population now that feels like that's dog whistle-y kind of stuff that you're attacking me from a certain side of the spectrum. So you made me hear me saying, and particularly in our trusted messenger program, false narratives and inaccurate information. That may shift over time. But I would love for each of you to tell me, because all of you do it and you do it masterfully well. And it is like people are competing and leading people astray. If you call it misinformation, or another way to define it is information that's erroneous, maybe without an agenda, it still can lead people into harm's way. Then what we call disinformation or inaccurate information with an agenda, like you shouldn't get vaccinated, but use my oils and my crystals because they're quite good. You guys take those types of topics on super well. So I would love for you each to take a stab at how do you decide what you're going to address? How do you approach it? You just get so angry because you saw a post that you do, like, what does it for you? And I'm going to start with Shabbir.
Yeah, absolutely. I mean, I just lean on my experiences. I've been doing this for 20 years. I've taken care of thousands and thousands of patients. And so I've seen the ramifications of all different types of decisions patients make. And so, I'm willing to share that on social media. Like you're saying that this thing is harmful. Well, I can tell you, I've got examples, without giving out patient information, of
Yeah.
course, that, when you do X, Y, and Z, these are the outcomes I've seen. And it's tragic. It's awful. It's terrible. And so, we've got all this information and experience to share. And it kind of comes back to does the public trust you? And so you build that over time through content creation, through being transparent and authentic, as the other panelists have said. And so once you develop that reputation of being authentic and transparent, you can share these patient stories, and the crowd will believe you, or certainly trust you that, okay, you know what, this person's been practicing for 20 years. He's seen what happens when you don't take care of yourself, when you sort of go astray, when you don't follow evidence-based medicine. So
Shabbir,
I just share those
give
experiences
us an
and stories.
example of something like recent that you went after that was inaccurate information.
Oh, sure, absolutely. I mean, listen, I take care of, patients with all sorts of cardiovascular risk factors. And so we talk about, cholesterol management all the time. And so I can almost see it coming. The patient's like, well, I've heard about these diets. Like, you're going to talk about the carnivore diet, aren't you? Right? You're going to talk about Liver King, aren't you? And so I kind of head them off. I'm like, listen, I see those videos too at 1 a.m. in my bed when I'm doom scrolling TikTok. So I'm there with you. I'm seeing the same videos as you are. Let me tell you something different, because what you're seeing is not accurate. That's not what the current evidence says. I've seen your cholesterol numbers over the last 3, 4 years. I know your family history. I know your smoking habits. I know everything else about you to make a good decision. Whereas this person just selling this product, selling this supplement, is only trying to sell your product with unscientific information, right? And so this comes up all the time. People are, what about this diet? What about the carnivore diet? All these types of things. So literally an every week topic for me in primary care, different types of supplements, nutrition. Should I buy this thing? Should I not buy this thing? Happens every day, every week.
Yep. Tommy, I'm going to let you jump on this next one. Just the motivation to go after inaccurate information, maybe an example of one or two that really have got you stirred up.
Yeah, of course. I would say that I think that, and not everybody agrees with this, but I think as medical professionals, if we know that that information is out there, not that we should say that it's our responsibility to debunk all of it, but I think if we're being active on social media and we see harmful misinformation that's being spread to our patients, we should have some kind of desire to want to correct it. And so I think that's probably where mine stemmed from, especially early on during the COVID pandemic. I was in Arkansas, and everyone in Arkansas was taking ivermectin and not wanting the COVID vaccine. And so a lot of it started there. So where I get kind of the content to make, one would be people tagging me in it. So eventually, as you start making content, people want your opinion about different things. And so I'll look through my tags whenever I have free time and see if there's something there that I should make content on. Two would be, what is the most pressing thing to make content on? And so, for example, with RFK Jr. and some of the things that have been going over the past year, autism, Tylenol, vaccines, all of those have been extremely important topics. And so knowing that those are what our patients are seeing and hearing, they need accurate information to combat that with, because if we're not out there making it, then they're just only going to continue to see the retweets and repost of the misinformation that is being spread. And then the third thing, which I rarely ever have to go to because the first two keep me busy enough, but would be searching Google Trends. And I go on Google Trends, I put over the last week, and then select it in the category of health, and then I see if there's any health topics in which misinformation is being spread. And if there are, then I'll correct those things. And then I would say the way that I go about correcting misinformation is maybe a little different. We all have our own personalities, but I try to be as gentle and respectful as possible while sharing the accurate information, because I think it does show a level of respect, even to the people who are sharing misinformation or inaccurate information, but at the same time, correcting them and letting them know, like, I'm a professional. This is what the data shows, and I'm not selling you anything else. Like, I'm only sharing this with you because I care about you and your family.
Yeah, that great point. I will tell you, in the Trusted Messenger program and in the Public Good Project, what we do nationally and internationally, which we didn't receive in medical school, was understand how to engage people in a powerful way. Our training really fails us, right? Because we're all about here. You're wrong. I'm going to show you why you're wrong, and I'm right, and then you're going to decide yes. But the real issue is people make decisions with how they feel, right? And so being respectful, but also kind of trying to access these values, beliefs, and emotions, strongest one being fear. We have to realize that's how not just patients, but we all, like, sometimes I know I shouldn't have that, shouldn't be up to like midnight doom scrolling. I really should go to bed at 10, but sometimes I'm still there. I know better, but right. So we all are possible victims of that kind of thinking.
Yeah. And Todd, I wanted to add one last thing about
Yeah,
something you just mentioned that I meant to say, but the other thing is that everybody on the side of maybe sharing misinformation or consuming misinformation, or sorry, inaccurate information,
yeah,
or
that's fine.
believing inaccurate information, they have their own stories and lived experiences as well.
Yes.
And I don't know what those are. I
Yeah.
have not walked their shoes. I did not have my 2-year-old that I thought was completely fine, and then they get a vaccine and then they seem to not be completely fine.
Yeah.
Like, I didn't have that experience. And so the way when I'm approaching these videos, it's like, it's not me to judge them. Like, I don't know why they believe what they believe or how they got there, but I can still respectfully disagree with them and show them what the data shows.
Yeah. And I would say when we teach, again, the work that we're doing, when we teach people about, powerful ways to engage and help people think through and guide through and support them through these things, nobody there, unless you have some Munchausen situation, nobody's making a decision that doesn't agree with your recommendation because they think harm's going to come to themselves or to their kids. They're doing it because they think it's the best possible thing, right? Because they're so scared of other options. But we all know on this call, as many of the viewers, right, that real outcomes that are very negative are coming. I mean, I would talk to like things about AAP data showing about the number of moms who are refusing vitamin K, right, for their newborns. And we're now seeing head bleeds and strokes and deaths, right, that are completely preventable by something we've been using for like over 5 decades. Vicki, what gets you going for tackling inaccurate information, misinformation, whatever I want to call it right now? And how do you choose it? What's got you stirred up?
So like the other panelists have said, I really do, there's so much going on just out there right now. I do think I make my content really just based on what I see. Obviously, it's very emotional of hitting the screen. It's too hard to keep up, right? So I don't think I'm choosing. It just comes in, and I'm just trying to respond as quickly as I can. And I know I can't respond to everything, but I do the best that I can. And something that I do want to just reinforce is like it's not going to be the one conversation. Like I know I'm realistic that my one video is probably not going to change a bunch of people's minds, right? What it really is, it's going to be my video on top of Tommy's, on top of Shabbir's, on top, on top of, like it's going to
Yes.
be the repeated message over and over from trusted messengers, including their doctor, that will eventually make them comfortable to make decisions. And I think that's important to understand also, to take some of the weight off of the things that we're doing, to understand that you're just one conversation out of many. And yeah, however you decide to do it. And it's also important to do it,
Yeah.
like
Well, and again, if you
more
aren't out
voices, the
there,
better.
yeah, if you aren't out there, if Tommy's not out there, Shabbir's not out there, then there really is just a lot of noise that some people well-meaning, a lot of people who aren't, that end up steering people into harm's way. So to your point, I will say, Vicki, and all three of you, that I now see a few kind of more progressive practices when it comes to social media, literally handing out a sheet of trusted content creators, like on your favorite platform, or, oh, you like TikTok, and they have a QR code, and they're like, scan this. This is 10 of the content creators we love. Like very few, but we're starting to do that work here at Trusted Messenger program too, which is find out like your patient's favorite platform, because maybe you aren't making enough content to reach them every day, or maybe their algorithm won't get you into their feed every day. But how cool is it that we can now say, hey, here's 5 providers I really love, or here's 5 that talk to the topic of statins or cardiovascular disease or fitness or ophthalmology or whatever. I think it's a really cool next wave of what we're seeing. I still think, and I want to point this out because it'd be remiss if I didn't from the Trusted Messenger program, nothing is more powerful than patients hearing from their own providers. Okay, so again, the point, if you're not yet on social media, I used to say when Chad and I were on the road in 2010, you just needed a really good website, but you should probably have considered social media. But like when 2020 rolled around, I don't think it's optional to be on social media anymore. And you could argue, because it's true, I think all of us started on social media a while ago, because I was on, well, before I was on TikTok too. Like there were the heydays where content creators are prized, and so they get lots of followers and lots of likes much more easily in the beginning than as the platform develops and gets more evolved. But if your patients know you're on that platform, they will come looking for you. If that's their favorite platform and I'm already scrolling on there, you could easily plug in your practice and see, hey, what's Dr. Jones have to say about that, right? So something to think about. All right, we are now into the bonus portion of the webinar where we are going to take some questions that are coming in. So Chad's feeding me some, and I'm just going to throw this out, and I'll give it, the first one that says they want to answer it, fine. And if somebody wants to chime in on it, that's fine as well. Question to the panelists. How do you handle people who say, I do my own research? Who wants to take that?
I'll start. I mean, I think as Tommy said, you want to be respectful. You don't know their experiences. You don't know why where they're coming from, what they're reading. And so whether it's online or in person, I get those lines in both mediums. You try to hear them out. Okay, let's hear what you have to say. And you hear them out. You don't shut them down. And you hear what they have to say. And then, if it completely contradicts what you know, you present the evidence, you present your experiences. And they're willing to listen to you if they trust you, right? And so it all comes back to the whole trust portion of it. People are going to do their own research. The information's out there. They're going to use, the chat GPT or some random website. So we just have to expect that. It is commonplace now that people are going to bring information. Some of it's good, some of it's not good. So hear them out. Don't be judgmental, and then present your point of view. And then if they do trust you and you have that good relationship, they will eventually, listen to you. But the key thing is not to shut them out, not to roll your eyes, just kind of hear them out because they're being constantly flooded with information and they can look it up at any time they want. So they're bringing a lot of stuff, a lot of baggage, and you just have to really let it out and just hear them out and then kind of build the trust from there.
And I know we're not just doing straight out communication, but all communication best practices, which is good active listening, good body language if you're talking to them about things. And again, trying not to go right up to here, but to kind of access down here, which is absolutely critical. I have a question for you guys, and I can tell you our story, but I'd like to hear yours first. Is how has the use of social media impacted your workplace? The people you work with, whether it's other physicians, maybe it's nurses, medical assistants, maybe it's front office. Do they know that you're using social media? Are they intrigued by it? Are they embarrassed by it? Like, do you have any stories about in your own workplace, the perception of your use of social media in the use of progressing healthcare?
I would say being active on social media for a while, most of my colleagues know that I'm on social media, uh, as in the entire hospital I work for, I believe. Um, so I think that it comes like everyone is very positive about it, which has been very, very nice. And they're extremely supportive of it. I will say, like, some examples, since they know that I'm on social media, oftentimes our child life department may have different schemes up their sleeves for me to do. So, one example, I go to see one of my patients, and there's a giant sign on the door that says, Dr. Tommy, I challenge you to do the worm for social media. And so I go into this patient's room and I've never done the worm and I have to attempt to do the worm. And I did it, thankfully, it went okay. And it got posted on their social media. So there's things like that. And then I think if there's any big initiatives we're trying to do as a unit or as a hospital, then it allows for a lot of like fundraising and things of that nature as well. So I'd say overall, it's been extremely positive.
What can I just ask? What was more scary, the world's most dangerous bike ride or doing the worm?
1000% the worm. Like literally, I think the only thing that would have been scarier would be if it would have been like a dance something. Like I had to dance for something. Now, if they watch this, the next one will probably challenge me to some sort of dance. But yeah, it was pretty rough.
Thank you for that honest answer. We have a question coming from, I would believe, somebody in public health because their question is, what advice do you have for a health department on their shared social media, especially around the topic of immunizations? And obviously, we know that public health and social and health departments are using some social media. So, any thoughts or feedback on that? I'll start. I'll start with one, which is just because you are a health department, right? The thinking has kind of be kind of very, very formal and very, official. But do you remember? Do you remember when the CDC ran an emergency, was it, Chad, it was disaster preparedness campaign? And the campaign was a zombie looking through these horizontal blinds. I don't know if you guys remember it, but what a cool, fun way to talk about disaster preparedness was a zombie apocalypse. It crashed the servers. So what my point here is, and I know I'm not speaking directly to immunizations, but my point is in social media, all of us like to have some fun. Shabbir actually literally threatened people as far as not being their friend if they used water to make pancakes or hot chocolate recently on a post of
Yes,
his.
not
I thought that
acceptable.
was kind of firm, but I agree with him. He says, like, I won't be your friend. And I thought that was a little harsh, but I think there was some validity to it. So, any thoughts on health departments using social media? Obviously, they have probably a little more constraints, but any additional thoughts? And
I'm
if
just going
not,
to say it's incredibly important work all of you are doing in public health, especially at the community level, especially public health at the national level is a bit of a what call it a mess right now, you know. And so public health departments at the community and state level, such important work. You know, within whatever constraints you have, just be out there. Don't worry about the numbers, the followers. Just be out there spreading the good message. And you know, be creative, have fun with it, you know, with however you're allowed to, and see what works. The key thing is just it's important what you're doing. The messaging is important at the community local level. Just be out there and keep plugging forward and doing something. And don't worry about the followers and the engagement. Just be out there and something will pick up and just keep moving.
and I'll throw a communication best practice for social media that if you want to take on myths, there's something called a truth sandwich because if you start with a myth or end with a myth, it can be a little more likely to be remembered. So if you're tackling a myth, start with a fact. You can address that myth in the middle and end with a fact. So that's a communication best practice that you can use on social media. A question just came in. What platform do you guys recommend starting in? If you're a practice or a provider and you have not dipped your toe yet in, but you're thinking of it, the question is, what platform do you recommend starting on?
I can take that one.
Okay.
I get this question a lot actually. I would start with a platform that you're already on. Keep it simple, right? If you love scrolling Instagram, start there. If you love scrolling YouTube, TikTok, I would just start where you are because that's probably the most natural transition. You probably understand that algorithm. You probably understand what videos work. And I would just start there. And just to tag along to that, we're all busy professionals. So whatever platform you choose, feel free to then repost to others. So, you know, my workflow is I'll make my videos on TikTok. That's where I feel most comfortable. And that video will get reposted to Instagram and then reposted to YouTube. And the Instagram will get automatically posted to Facebook. So my one video is now on 4 platforms. So that's my recommendation.
Yeah. That-
Yeah, the only thing I would add to that is I wouldn't give you the choice of adding it to all platforms. I would say you have to. So just
Wow.
because it
Wow,
takes,
you're throwing down, Tommy.
yeah, it takes 1 minute. So like if you don't, you're just missing the value of what you just made. Like it literally takes 1 minute just to throw them up there and leave it. And so it doesn't take that much extra work. The other thing to know is that Facebook is the largest platform with so many users that your reach there to be absolutely insane, especially for most of us, I would say, are older than 20 years old. And so the population that's going to be watching our videos a lot will be on Facebook. And so Facebook has extreme value, in my opinion. And so I would definitely recommend exactly what Dr. Vicky said, but with the must post everywhere.
All right, this is a question. It's 2 questions, but I think it's you could answer it as one. Do you need to moderate comments? Do you just ignore negativity? Do you remove it?
Block, ignore, hide. You don't have time for that. Like seriously, you know. And the reason why I say this is because yes, certain topics are very controversial, like vaccines. But I also get negative comments on things like when I post about my dog or Disneyland. You know, I mean, they're just everywhere. It's just not
Yep,
worth it, you know.
yep.
And so sometimes, okay, so what I will do, okay, so this is, you know, you don't have to do this, but sometimes I will take a comment. I know I have a really good response. Okay. And my goal is not to, you know, stick it to that commenter. My goal is to take that comment and use it as a education platform,
Mhm.
right? To educate other people. That's probably where I will respond and leave those types of comments just so they can see. But like the really nasty ones, they just, you know, they get blocked and hidden and yeah.
I will add to if anything is nasty, I mean, you know the nasty one. Sometimes people throw in the half-hearted question and then it turns negative. But anytime something becomes negative, offensive, threatening, nobody here is asking anybody to be a punching bag. And that falls under the category of don't feed the trolls, I suppose. You don't engage, you hide, block, ban, delete. If somebody's being offensive or threatening or mean-spirited or mean to other people on that thread or on the feed, anybody else want to jump on that? Because I have other questions, but I don't know if anybody. Tommy looked like you're ready, or Shabbir. I wasn't sure if you had any thoughts on
Shabir, you could add your 2 cents if you'd
that.
like. I have a very opposing view, so I don't know if I should share it.
Well, I mean, this is
I no, you know what, Tommy, I totally get it. And I think, and I'm just gonna, being a woman,
yeah,
uh,
yeah.
I suggest maybe, it's safety sometimes. Because what
Yeah.
I'll do sometimes if it's really nasty is I will screenshot it first,
Yeah.
purely for safety, right? Like I want to know who this person is because if something ends up happening, I want to know, and I will screenshot it and then block it.
Yep.
And so I just offer that. Like I get it, Tommy. But maybe there's just maybe an extra layer that I have to worry about. Maybe that.
Yeah. No,
Yeah.
I think
That's
this
all.
is
I mean, I totally respect. Yeah.
no,
What
this is a good conversation. Like I think people here, like I've told you, like if you don't know the story of our practice, we were the target of a global coordinated attack where we had over 10,000 attacks, lots of vitriol within 6 days, 10,000 attacks on our Facebook page. And we got to the point, and I eventually got to the point with my own where I did block and ban if it was nasty or just really mean spirited. But Tommy, I want you to talk about your differing opinion. This is the beauty of this webinar.
So I would say that I want to I understand what Dr. Vicki is saying, and I'm saying this obviously from the position of, a white male that is very privileged, right? And so it's easy for me to say this, I will say, but I choose not to block anyone, even if they're very nasty comments, and I choose to respond to most of them, or the ones I see anyway, with love and kindness. And the reason, and just so everybody knows, I'm like probably the most optimistic person in the world to a fault. Um, because the way I see it, that if those people who seem to be so cruel and negative and bashing me and anti-science, they expect for me to block them. They expect for me to lash back out at them. They expect me to show them hate. But if on the flip side of that, I show them love and kindness and respect, that's the only thing that will ever change their mind. And maybe it won't, but if there was ever one thing, it would be that one thing. And so I've had multiple very angry people that I've showed respect, love, and kindness to that have eventually, maybe not completely changed their mind, but are very, very close. But there's great risk in that because there are people with mental health issues. There are people with all other kind of issues that you are putting yourself at risk, right? And so I will say, when I was in residency, we had death threats because I was talking about the COVID vaccine. That's real. That's palpable. That's scary. And so there's obviously a fine line that you have to balance, and you have to decide what that is for you. But at the end of the day, I feel like if in my heart I know that I'm doing right, and if that comes with supreme negative consequences, then I know that at the end of those consequences, I did the right thing.
Yeah. And I would also say it's your own internal resources. Some of
Right.
these can be bots and paid trolls that aren't really there to act on their own behalf. They're just there to sling mud, right? So I think you guys are both also talking about where you draw your own personal line on your own personal resources. Shabbir, do you want to throw in an answer to this?
No, I'll take the middle ground. I know I can definitely see. I think the key thing is just know what your line is. You know what your line in the sand is, right? And stick to it. I mean, this is extra part of your life, right? For most of us, our day jobs, taking care of patients, our families. I mean, that's, the day-to-day life, and what you're putting yourself on social media is something extra. It's supposed to add something to your life. If it's something that's physically, mentally draining, something that makes you unhappy, makes you feel nervous, unsafe, that's important, right? This is something extra in your life, right? So nothing should bring that much negativity into your life. So have that line in the sand. This is going to be fun, enjoyable, something that makes you feel good. So if you find that's not the experience, then definitely block or even take a break. I've had to take breaks for weeks and months at a time because of negativity, and that's okay as well.
Yeah, no, fair enough. I will go back to a lot of what we talk about with the trusted messenger is overwhelming data that people trust healthcare professionals and doctors are serve so many patients, obviously, and we have lots of other people that work in healthcare. But I would say we have platforms when we go on social media to be able to impact lots of people. We have one last question that I think we have a moment for, which is how do we avoid being cringy? Who wants to?
Sometimes cringy gets views.
Exactly. Cringy is not something to avoid or be afraid of. We all are at some point in our lives and just embrace it.
Tommy, cringy?
I would say just be you.
Yeah.
And if parts of the world think that that's cringy, then let them think that. But be authentically you and let it rip.
Yeah, the authenticity of being genuine is really what this is about. We are not there to be a news anchor or a weather person. We are just being ourselves on video. Some of us are more serious in the content we create and just do that. Some people do some shtick. Like I said, I've done some singing. I've done dance offs on social media before. It's just whatever you have fun with. Have fun with it. I mean, if you're not having fun with it, back to Shabbir and Vicki and Tommy, all of you guys, like this should be an added thing to your life that brings some good, either in helping patient, feeling that allows us to help more, and also gives us something back. Um, as we round this out, I want to just get maybe a minute or so from each of you on. Okay, so we have people out there that are trying to figure out what to do with healthcare. What last words do you want to leave them with? Let's start with Vicki this time because I started last with you last time.
My last thoughts. My guess is if you are on this webinar, you are compelled to do something on social media. So if you are here, just do it. Okay. That's it. That's all I have to say.
Just
right?
do
Just
it.
start. Just do it. Jump in. It's going to feel cringy. It's going to feel weird. Not everything's going to land, but you're going to figure it out. I know you will, 100%. So I would say just do it, go for it, and we are behind you 100%.
You heard it. Dr. Vicki Can, just do it. Should be your.
Yeah, my final message would be I think healthcare and social media are sort of intertwined, and there's no changing that. This is, we're not going back to a time where social media doesn't exist, right?
Very true.
And so just recognize the powerful tool, one that can be fun, but one that's, intimately tied to healthcare now. And so we need all of you out there. There's just plenty of good work to be done, a lot of advocacy to be done, a lot of change that needs to happen in healthcare. And we've got a lot of really dedicated people in healthcare, nurses, doctors, PAs, NPs, and we need all of you out there to sort of fight the good fight and spread good information, spread joy, spread love, all that good stuff.
Thank you, Shabbir. Yeah, get the word out. The more of us, the better. Dr. Tommy Martin.
Yeah, I think I just kind of end with kind of what I started with, and that is um, do it because you love people and that you want to help people, and that if it helps one person, then it's worth it. And the only thing that I would add to that is do not feel like you have to be perfect and do not feel like you have to have fancy things. I think the majority of us just film with the phone that's in our hand. Like I never use a mic, I never use anything. I just film with my phone. And then the last thing that I'll say is as you get started, um, just remember like what an honor and privilege it is that someone would care enough to take 30 seconds, 60 seconds to watch a video you created, and that you will literally get to sit in the living rooms with families as they see your content. And like what a pretty incredible honor and privilege that is.
Being able to be right there in the living rooms with people, Tommy, thank you. And the privilege that it is, an honor to be able to reach people this way. As the executive director of the Trusted Messenger Program, I will just say, first off, thank you all to our panelists for joining. Thank you all for those of us who have joined us both live and that will be seeing this recorded. I will tell you that lots of people are competing for the eyes and ears of our patients. And they have not taken oaths to do no harm. They also don't have the wealth of medical expertise and experience and education that we have. And I think in 2026, there's laws for patient abandonment, and I think we're abandoning patients when we're not where they're at. This is the definition now of meeting people where they are. If it's not done down to the level of the healthcare provider, it could at least be done down to the level of the practice. I think that's critical going forward. Thank you all so much for joining us, and thank you, panelists, again. This is just wonderful. Thank you. Thank you.
Thank you. This is great.
Thanks.